Today we're welcoming Kenneth. Thank you so much for organizing this. Kenneth reached out a few months ago to say, hey, I'm ready to offer something. I have a couple case studies. Would you like to hear about them? And I hope you'll be back, Kenneth, with the second case study. So we'll start with this first one. And for those who don't know Kenneth, Kenneth is the author of the book, Small Steps to Big Changes. And that's what he'll be sharing with us today, is how to bring in organizational change with SF, and how to do it in a very, maybe starting from like the people, not so much top down, but really across the organization at the same time. And he's a speaker, so you've been speaking a lot for many different companies around the world, and today you're with us in this global chapter. So welcome, and thank you so much for taking the time to be with us, and enjoy.
Hi everyone. First of all, thank you for your time. I really respect your time, and I want to acknowledge that you could be doing millions of things right now other than being here. But you chose to be here. You made a choice, and I just want to honor your choice as well, that you choose to learn, you choose to see how SF is being used in organizations. And today I really have prepared I thought was a really good session. I prepared a lot of ideas of how do we actually implement SF across, not just in a small group, but an entire organization as well. So I'm going to share with you very specific case studies, exactly how do we roll out the whole consultancy process. And especially, if you want to move away from just transactional training and want to focus on delivering business impact, what are the steps, what are the rocks that you need to focus on, the big rocks, and how do you actually create a process that will help your clients achieve results? Because at the end of the day, I hold this philosophy that clients don't buy programs, they actually buy results. Think about it. They buy a program to get something, and they have an existing problem, and if you can help them see that what they are getting from you is a closer step to achieving a business result, I'm sure you got their attention. Okay, and this is exactly what I'm going to do. I'm going to share with you the whole process that we use, and hopefully to challenge you to see how you can structure your programs a little bit differently to focus on delivering business impact. So my job, is I travel around the region to speak in conferences. So I wrote a book called Small Steps to Big Changes. It's a physical book. And I'll be sharing with you ideas from it. Okay, and I also want to acknowledge, I have so many beautiful colleagues who have taught me, when I was a lot younger. So I see many of them here, and I want to acknowledge all of you for coming in and being part of my life. And I have achieved so much is because of you. It's people like you that have inspired me, and right now we have found to have worked really well in organizations. So let me just start sharing exactly what is different. So the ideas I'm going to share are all basically from the book Small Steps to Big Changes. So I'm just curious, as you talk to leaders, what do you think is an important thing that leaders are looking out for? If you want to get the attention of senior business leaders, what do you think are the important things that leaders are looking out for? Okay, so I'm just curious, can you please type in the chat right now? What do you think are the exact things that leaders, that keep leaders up awake at night? They keep them up awake at night. Can you please type in the chat right now? Results, improvements, how to support, support organization, support people, collaboration, fantastic. Happy team members, shaping tomorrow, okay, fantastic. Okay, I just want you to take note, as you share all these ideas, my question is always, so what? So what? So what? Why do we need to get people to support each other? And why do we, what does a happy team members get for you? So I just want to think about what's the purpose of having happy team members? So what? So what does it actually deliver? Yeah, if you think about it, mostly, and it's right, is because of outcomes. They want to see outcomes. They want They want measurable business results. And that's how we get the attention of leaders. If you talk about nice culture, yeah, that's nice. People love each other, fantastic. Not saying that it's wrong. It's a great thing to have. But what actually attracts the leader's attention? And we need to be able to speak about business results, because end of the day, if it's not going to help me achieve or help an organization achieve its results, it's basically you have a program that is nice to have. It's really nice, but it's not absolutely essential for them to achieve the results. So therefore, we're going to focus a little bit more about results. And I want to just suggest that there are a few things that leaders are looking out for. I will put them into two categories. The first category is what we call the increase category. And if you think about it, leaders want to increase revenue, right? They want to increase sales, profits, productivity, market share, client satisfaction, and many more. They have absolute numbers that they are measured against. And if you can show them a way of how you deliver your programs, how your programs can deliver on these specific numbers, you'll get their attention instantly. And of course, this is the increase. There are many more. Of course, there is also the decrease side, which, we want to decrease our costs, our risk, the lead time to do things, the loss of talent. We know that attrition is costing companies money. And of course, how can we reduce the lead time to go to market as fast as possible? Can we take some ideas and move people forward fast? And I'm very sure that, if you were to talk about such things, you will always get their attention. And this is the premise of all these that we're talking about. We need to help the leaders to focus on results. And I want you to right now think about what are the ways we can actually help leaders to achieve their business results. Okay, and remember, these are all real business results that every single day they're probably thinking about it, they're dreaming about it, and they carry this burden that they have to achieve, because they are there for a reason. So I want to share with you the approach that we use in Deep Impact. This is basically a consulting approach. I used to be a mechanical engineer, so I need to see things in a systematic way, in a process that I can understand. So sometimes when I learn SF, it's a very it's very flowery. So I don't understand. I really don't understand it because it's very flaky, at times to me. But I'm right now going to approach it from a very different angle. Maybe more on a hard angle on how does it really achieve business results, okay? Because that's how I understand it to be. But the languaging we use is going to be pretty much the same. And I'll focus on how do we get the leader's attention and how we deliver a process that will meet the business outcome using solution-focused approach. So let's just carry on. Okay, so I want to share with you this 5Ds model, this 5Ds framework that we use. Basically, I think is very useful, and I will share with them, more in detail. Basically, there are just 5 areas. Discuss the business needs of the organization, and the only way you can do it is with the senior business leaders. What are their business needs? And can you define stage 2? D2 is what we consider as, can we define their leadership involvement? What is it do you need from the leader to be able to push things through? Okay, and to deliver organizational outcomes. Number 3, we need to create an immersive experience. And that's where you do your training. You need to create a sense of confidence, deliver the competencies that you want them to achieve. And number 4 is basically what we call determined focused action. That means it's not just random actions, but they must be focused on delivering a very clear outcome for organizations. And number 5 is to document sustainable change. That means we need to help the organization see that as a result of your intervention, you have achieved a certain outcome, and what we have talked about earlier, you have increased something or decreased something. And that makes sense to them, because once you are able to show the leaders that you have very clear outcomes, or you're able to demonstrate it clearly, all of a sudden you have sealed yourself. You are sealed in an organization. They know that your program is really important, because without you, they cannot achieve those outcomes. Okay. So I'm going to go through all these 5 steps, and I will share with you exactly what we say or what we do in this whole process as well, right? And I hope that will give you some ideas on how you can engage your clients a lot better and turn SF into helping organizations see that SF is really crucial in delivering business results. So let's talk about the first one, discuss business needs. Okay, so I'm going to share with you the very case study that we worked with. We worked with a very large public hospital in Singapore. It's about 4,000 people. The business environment in the hospital is really fast. Things are moving very fast. And of course, they survived COVID. COVID took the life out of them. They were fighting many parameters at one time. People are tired. They know they're doing a noble job, but they're very tired. And of course, there's increased demand, right, in ensuring that the cost of healthcare does not escalate. At the same time, they want to bring the healthcare costs down as much as they can, but yet achieving a certain standard, a high quality standard. So in Singapore, the healthcare system is really good. Okay, there's a fantastic healthcare system, but the people are overworked. They're very tired. And when we work with this group of people, when I started talking to the business leaders, interestingly, how it all started off was just a simple talk that I delivered in a conference. Okay, it was, I just gave a talk in front of 800 over healthcare professionals. And 2 years later, I got a call, from one of the doctors who was leading the smallest department in the hospital. He only had like 16 people. He said, I'm from medical affairs. And basically in medical affairs, they find out from all their job is to find out what happened, and they are very diagnostic in nature. If anything goes wrong, medical affairs will come in and they'll investigate, see if there's any negligence. And we talk to medical affairs, it's a very stressful thing, right? Because they're there to find and analyze problems, find out who did it and what's the wrong thing that they did. And of course, we share with them the whole solution-focused approach, how conversations can be optimistic. And the leader loved the idea so much, and they saw good results. And after that, he has achieved very good results because his department are basically internal consult. They work with the rest of the hospital. They realize that they are able to lower the resistance in getting cooperation from the rest of the colleagues by using the solution-focused approach. And eventually, this guy got promoted. And after a while, he said, Kenneth, can you work with my team? So right now he has a bigger team, which is 24 right now, 24 people. And so from 16 to 24, but right now he does quality improvement projects and they are able to do it on a large scale, in an organization. So he started using our principles and ideas across the organization. He had really good results. And of course, this caught the attention of the CEO. And that's where I told this doctor, the directors, telling him that if you want to see large organizational change, let me just speak to the CEO and let's explore what could be different and better. And of course, when I started exploring, the leader, the CEO will just share that, the hospital, there's so many things that he wants to achieve with the staff. He wants a lot of improvements, changes, the quality of patient care or the patient experience has to be better, and he finds that it's so difficult to change people's mindset. What the senior leaders want is not evident in the ground level. So there's a certain disparity and when you talk to the ground level will say that, they feel hindered. They feel that in order to change one thing, they must change 10 things. There's this sense of helplessness at times that it's so difficult to just lead change with where they are, with what they have. And not only that, in a hospital environment, it's a very complex environment because, there are medical issues, there are just so many different decision makers. And not only that, if you're not the doctor, you don't call the shots, and there's a certain difficulty in pushing things through as well. So how do you work, navigate people through a series of change that get them to believe that things could be possible? And how do you start changing it from the middle and downwards as well? And this is what happens. So when we talked about, defining what's the business outcome, so we started asking the leader, what would be important to you? What exactly, suppose if things were different for you, what difference we want to see? And that's where we introduced the miracle question. And I realized that we are able to steer the conversation away from, oh, my people are, from the focus on problems to the focus on what would they want differently. And that helped us shape the nature of the conversation. So we started asking two questions I thought that was really useful. What is a top priority, if tackled successfully, would increase your business level of success? And what would success look like? And the second question, regarding what you have said in question number one, what do you think needs to happen right now to move towards that direction? And the interesting thing is, the conversation that I had with the CEO started, he started focusing on, yeah, actually I wanted to see this, but I'm not seeing it right now. And he liked this approach so much that he said, okay, would you like to talk to my senior leadership team as well? Okay, so that's where I know that I needed to go into the second level, the rest of the people. And of course, I interviewed every single one of them. And I started asking them, if you could change your culture, suppose if your culture is different, what will you notice will be different and better? And the best part is these conversations provided a certain context to certain things but we started focusing on what would they want different and better. So defining the business outcome is important, because once you start shaping that, okay, I actually want my staff to be engaged. And we started asking them questions like, what does engagement look like to you? How would you know that you need, what's something that you must see right now? They will tell you that staff are engaged. And when you let them clarify, even senior leaders, when you start getting them to describe them in behaviors, describe them in the future orientation of things, and all of a sudden, we realized that we were getting a lot closer to the preferred future. And that's important. I think so when you get senior leaders to talk about what's a real business outcome that they want to see and what could be different, I think they're really excited. And all of a sudden they say that, this is something that I want to see happen differently. I just don't know how we're going to get it. And that's where we started presenting our solution. Small steps to big changes is about a program where people can leap, can create possibilities, focus conversations around what works, and how to create momentum. So we were very specific in the outcome and what we're trying to achieve. Could SF be used for many things? The answer is yes. But if it's everything, it's difficult for a person to understand. But when we started focusing on how can you lead change with where you are, with what you have, and how do you create forward momentum in that actually developed into a very useful proposition. They were really, really excited. And the leaders started saying that, okay, we are excited about it, and we want to explore further. So my question, what do you think are some solution-focused questions you need to use to uncover business needs? And of course, it's very important that we don't just ask questions about, what's not working, because that's not exactly very solution-focused, but sometimes the client explains it to us in things that are broken, right? But we need to help them make sense to what they want instead of this brokenness. And I think this is where the solution-focused conversations come in. So I'm just curious right now, what are some solution-focused questions you can use to uncover business needs? Okay, so we're going to do this, I'm going to break you up into rooms, and you're going to just discuss with each other. There'll be probably like 4 or 5 of you in the room. Just say hi to each other and which country you're from, just introduce yourself and go straight into this question. What are some questions that you could ask to help your leaders to focus on their real business needs? And we're talking about usually business needs. How do you know whether you have a real business need? If they're able to quantify it in a number, in a specific number, that's important, because it's not just an outcome, right? It has to be a measurable outcome as well. So I'm just curious, what are some questions that you could use to uncover such business needs? And right now I'm going to ask Annie or John to break everybody up into groups of 5. You'll be given like 8 minutes to just discuss. Yeah. Yep. Awesome. So for those who just came in, right now we're just discussing about what are some questions that we can use to uncover business needs, solution-focused questions. And we're going to type them in the chat right now so that everyone can see them. Okay. Wow. Look. Anya, is it? Wow, love it, love it. What will your client notice that you have improved? How would that look like? How will your colleagues notice it? Okay, and how will your partners, and of course the different stakeholders in the business. So of course there were some future forward questions where we focus on, if we meet 2 years from now, how and your business needs are met, how will we look like and what is different? Fantastic. Okay, so you can see all the different questions. What difference will we make, and how will you or others notice? Fantastic. Okay, good. And Jenny mentions that, what effect would you like to have, and what is your target? Even being very clear, what are your targets? Or even sometimes when you talk to leaders, what are your key business results they are looking for, especially in this year? What? Uh, okay. And of course, in the hospital, how will the patient notice that you are where you want to be? Nice. Okay. What are your best hopes regarding the organization at being the best at its most fulfilled state? Nice, nice. Okay. Fantastic. And of course, there's some discussions about a value stream design as well. So I'm just going to move on, to talk about how the consulting process. As I mentioned to you, so the first step is always to define what's the business outcome. What does the leader want to focus on? And usually they are on some numbers. And specifically for the hospital, they have identified very specific patient experience scores, numbers that they are looking at. They're looking to reduce the attrition as well, and of course, they're looking at productivity as well. So the second stage, okay, is to define the leadership involvement. So a lot of times we notice that programs don't work very well is because the leaders think that, my people are the ones that need the training. Everybody except them. So that's where the problem is, right? So we need to define how does the leader get involved. And we're not asking for a lot of involvement for the leaders. We are asking for some specific levels of involvement. Let me share with you what exactly are the levels of involvement. So what we did with, we specifically asked the senior leadership team to actually go through our program. So that was the first thing, because we told them that in order to have consistency in the language, we need everybody to speak the same common language. Because imagine what if the people start talking about possibilities and their bosses are the ones that tell them, hey, why are you talking about possibilities? And develop an incoherent language, and everything is going to fall. So what we did was we asked the leaders, you may not need to go through the whole full program, but you can go through a 1-day bridge program. And they were very happy, okay, and finding a day that would suit everybody in the senior leadership team was like aligning the stars, but it happened, it was possible. It is possible. And we found 2 half days to basically help them go through. And we started defining, what's the role of the reporting officer. So the reporting officers are basically people who are HOD levels, or basically one level down, people who have a certain span of control, especially there are few managers or supervisors reporting to them. So we started briefing the RO, the reporting officers. We told them about what's their role and involvement, that they need to start talking to their staff who are going through this program. So this program was specifically for middle managers and even to supervisory functions. So even supervisors as well. So they need to hold this conversation with the leader, this manager or supervisor, to start talking about, what are some current existing challenges that if things were different, they will be really, really happy. Yeah, if things were different. Of course, every single person will just start sharing things that are personal to them, right? They start focusing on real business issues. Okay, and I'll share with you later what are the specific areas. And this is important because once they have this conversation with the reporting officer, they realize that, okay, now I don't just attend a program just to learn something, but when I talk to my RO, I know that after the program, I have to implement, I have to work on something. So they attend programs not as like a tourist, I'm away from work for 1 or 2 days. I get to eat all I want or just relax. But they go in knowing that there is a real business challenge that they need to work with, and solve as well. And this is how we we get the leaders to hold this conversation. We give them a script and they start holding a conversation and identify a real business challenge that they need to work on. So everybody that goes through this program comes in prepared with a very specific business challenge. And of course, the leaders' interest, the leaders are very happy, right? That, well, there's just so many different challenges. And right now, their managers and supervisors are taking ownership to work on it without the leader being involved. So can you imagine how happy the leader is that you're actually solving a real problem? So that's stage 2. The leader has to be involved in some way, but not necessarily, not too much, because the leaders have too many things to do as well. The third thing is to deliver an immersive experience. So we wanted to make sure that the program is something that they could use. So we identified certain competencies that they need to develop. And we ensured that it wasn't so much of teaching the content itself, but helping them to be confident in using the program as well, the techniques. And this is important because a lot of times we focus on the content part, but you only get confident when you start practicing it. So how do you create an immersive experience where everybody gets to try it out, and in a very fun environment, and we give them very specific case scenarios that's happening in the hospital to actually work on it. And what we've noticed to be really fun, it's we actually use this model, which is what we call the deep model. So my company is Deep Impact, right? So we have the deep model. The deep model is basically a solution-focused model where we talk about, we design a preferred future. And of course, it's an acronym. And E stands for explore the current position, where are we, with respect to this preferred future. And we examine what works and we plan steps forward. So everybody was trained in this model, and they will use this model a few times in the discussions. And the aim is to use this model outside the training room as well, which I'll describe to you later. So they have to practice the model using very specific use case scenarios, and they have to learn how to share their success stories with it as well. Okay, so that's the D3. So that's the step, create an immersive experience, deliver an immersive experience. And the fourth part is something that I need you to really pay attention to, because a lot of times we notice that training programs don't work really well. People just learn, but I don't know about your side of the world, or maybe it's Singapore thing that we learn a lot, but we don't apply. We just don't actively apply. And we all know that you only get results if you actively apply, right? Application is key. And this is where we need to help the clients to focus on delivering outcomes, work on it. So we have moved away from just traditional programs where it's just run a program and that's it. But right now we have introduced a model where every part of our program, once we've run the program, we follow through with the client for 3 months. We get them to be involved in working on a real business case. Remember what we shared earlier in number 2, where we got the leader to define what's work out with their participants some of the real issues, and all these participants, every single one, imagine 20 at one go, they will have 20 different things that they want to work on. So each person will have one area that they want to work on, and so I want you to just right now consider how we can move the finish line, rather than think about the program as the end of everything, and we leave the application to the client. Why not we help the client to focus on application so they can achieve business results? And that's the key, because if there's no consistent follow through, there will not be any business result. So most companies employ what we call a hope strategy. They hope their people apply. And we all know hope is not a strategy. It's just hope. But when we intentionally build in the application process that we get, so we tell the hospital that, okay, it must have some big changes. There's the learning component, but it doesn't stop there. It doesn't end there. There is actually a 3-month follow-up process where they will have to work on certain things. So of course, we tell them to work on a mini initiative. So this mini initiative cannot be something that is totally new to them. It must be focusing on a real existing business challenge that they have, a problem, some challenge. And we start exploring what will be better and different in this challenge and what's the results they want to deliver. We need to frame it as it has to serve the interests of that person as well and the department. It cannot be just serving the interests of that person. It must serve the interests of the department and their stakeholders, which is the patients at the end of the day. And because they're working on it for the next 3 months, so we give them certain markers that they have to use the ideas that we presented to them in the program, and they have to consistently engage a team of people to work with them. Because the whole idea is not to solve the problem by themselves, but actually to co-create with their colleagues on how to create a better outcome and create better results from what they are currently experiencing. And this co-creation process is really important because when they start intentionally finding their colleagues around them, they start, we told them that we are not looking for a big team, it's just a few people. But what we need is people who have vested interests, who share the same, frustration as you, and they just want to solve something, and they have interest in making that one thing that you share with them, better. And they found out it's just, even if it's a few people, we have groups as small as 2 persons, as large as 10 persons, and they started co-creating and using the deep model in the discussions. So my question right now to everybody is, how could you modify your existing program to help your clients focus on applying what they have learned and also integrate it into the daily work practices? That's the important thing, because learning is good, but you know what? Results are even better. We need to help the client achieve results. And the only way, I find it that it's not the only way, but one of the good ways is to be intentional about the practice of it and working on a real case and then focusing on delivering a certain outcome within 3 months. So that's why this focus action is very, very important. It helps the client to move away from, I've learned this, to I'm going to apply it and I've seen these results. So my question, I say again, is how could you help your clients focus on applying and integrating solution focus into the daily work practices? So I'm going to right now break you into rooms. You'll be another group of people, and I want you to discuss, because this is the important part, because only when they apply, they will definitely see results. Okay, so I want you to just share, what are the ways you could, let's come up with many different ways to do this. And I need to stress that this part is really important, because if you're not able to, we need to be able to move away from transactional programs to focusing on delivering business outcomes. Because at the end of the day, the program only makes sense if there's a real business outcome. When people are applying, when they are doing something, and they can see results. And that's where, I think sometimes we don't pay enough attention to the business outcome and helping them to apply. And that's why sometimes solution focus may be seen as a good idea, but it doesn't demonstrate the outcomes that they want. Yeah. So I'm just going to move on, and I'm going to end very soon, and we'll share with you very specific stories. The last stage is basically document sustainable change. And I think one thing that we did well was we got everybody together after 3 months to present what was better about their mini initiative. And this is important. 3 months is not going to move the mountains, but in 3 months, they can make a difference. They can shape something. And the whole idea is to help them see that if they can think about what's a real thing that they want to work on, things can actually happen because they thought about it and they started to work on ways to move the needle. And, in most training programs, I've talked to enough leaders, and I realized that a lot of leaders sometimes, they make statements like, senior leaders, I send you guys for training, but I honestly don't see what's the outcome. They have no idea what's a visible outcome. And the participants, because they don't work on it, so that's why there's no outcome. And number 3, the training managers also find it difficult. They thought that this program is going to be useful, but they can't measure in any way how it actually contributes to the business. So by actually having a follow-up session and helping the people to go through a process, a 3-month process, and presenting it, and what we did, what we thought was really good was we got one of the senior leaders to come in every session, when we have a review session of this mini initiative, one senior leader will be there, and he or she will be sitting down listening on what's better and different. And we told every participant, you only have 4 minutes to share a specific, what's your challenge and then before and what's after as a result of the intervention. And the beautiful thing is when they started sharing, wow, when I went for the very first sharing itself, I can tell you I was visibly moved to tears. It's amazing of all the things that they dreamt, and they started seeing results. So this is important because all this, I shared with you earlier, now the leader hears firsthand what's better and different. So they're very happy because they can see results. Number two, the participants also, because there is a reporting line, they start paying attention to doing things because they want to show for something. They want to show something useful as well. So they start working on it, and therefore they get better results. And number three, the training manager also wins because now they can see that a program leads to a visible and demonstrable outcome. And that's important. Everybody wins. and this is how you help everybody see that, because of this program, it has made a difference. So I want to share with you very specific cases, So what were some of the projects that the mini initiatives they worked on? So one of them was an orthopedic nurse who shared that, they have actually an equipment setup, a very specific equipment setup that they wanted. But the problem is new nurses and doctors who are trained in this process, it takes them a longer time to set it up. Of course, they'll go through the training, but you can't really remember everything after the first time of learning it, right? And to be able to set it up when things are pressurizing is actually very demanding, especially when you need to do it fast because a patient is waiting for you or there's some injury and you need to quickly set it up. It's very, very pressurizing. So this orthopedic nurse said, what if I were to, they learn ideas about how do you reduce friction, how to create a way that everybody can win and systemize the win. So he was thinking of, can I create take photos of the exact setup that we need, and I label all the specific equipment. Where do you find it? Which part of the drawer is that? And they could set it up in half the time. And when he just took, it's just 4 pictures that he had, and after that, everybody could just look at the photos and they just set up accordingly, and they knew where to find what equipment and where exactly it is as well. And this was really fast, and it could, no longer you have to be experienced to know where everything is. Right now, you just need to follow. And in fact, it was so good that the chief medical board, he saw it, he said it's a great idea, and he took that 4 photos, he digitalized it, and it's put in an iPad, and right now 100 over orthopedic nurses have access to it, and they are able to do this setup seamlessly in half the time. So from 30 minutes, it's now 15 minutes. Wow, so exciting. The second case was a radiographer. She had a lot of x-rays, and I found out that sometimes in our hospital, when they take an x-ray, it doesn't mean it's a good quality x-ray. There are sometimes errors. When they take an x-ray, the radiographer thought it was good, but when the doctor looked at it, he said, I can't make sense of it. Can you retake again? And imagine the patient looks at the doctor and say, what do you mean you want me to retake again? I need to fast again. And, I go through that process. It's a very unpleasant experience. And so she came out with a process. She discussed, she co-created with her other colleagues, and she was able to reduce the error rates by 25%. That's amazing, right? That's 25%. And the last one, which I remember, was a sister. She was the assistant director there. And she said that in morning roll calls are actually very negative, when they hand over the shifts, right, to the next shift. What happened in most conversations are usually, oh, that patient complained last night, this one had a fall, be careful of this patient, that one vomited. And it's, imagine if you're the next shift that takes over, there are 10 landmines that you have to avoid, right? You have to be very careful, and it's very stressful. But what she did, after going through the program, Small Step Big Changes, they started focusing on how do we create, identifying success, and how do we systemize it So she started changing her conversations to, I'm just curious, team, what did we do last night to create a great patient experience? What was different about that time? What do we need to pay attention to, so that we can recreate this experience again and again? And these conversations are so beautiful. And all of a sudden, people started having conversations, very motivational conversations, because everybody learns how to win at work. And this is how we are able to position this program, before the client, that it's about creating more wins, identifying, systemizing it in such a way that everyone can win, and not have heavy conversations that you feel that they must change everything, but they just need to focus on small steps that will lead to bigger changes at work. And these are the real cases. So that's why the fifth part is important, and the document the changes. And not only that, we started asking the participants to think about what's the cost saving like, how much does it cost to do an X-ray again, and are you able to extrapolate it over a year? How much will it save the organization or even save the patients? And wow, they started calculating. Some were a lot better than others in calculating, but the rest were just motion studies, like, from 241 steps, right now it's 42 steps. Okay, that's time savings as well, right? But they were not able to quantify because they don't know what's the labor cost. But it's fine, but they are able to calculate the differences, and that's enough really. And that's the beautiful thing. When the senior leaders are there, then after a while, the senior leaders, more of them started appearing, that all of a sudden the chief medical board will be there, the chief nurse will be there, and she wanted when she started hearing what are all her nurses doing, she started appearing more and more often in the presentations, because she wanted to know what's happening on the ground level. And that's how the senior leaders can actually hear firsthand experiences, and not only that, share the beautiful things that's happening at the ground level. I've shared with you the 5 steps of our whole consulting process. And I guess end of the day, I want you to think about what needs to be different, in the way you engage your clients in your training programs. How do you actually help them focus on a very clear deliverable and focus on a process, and move away from transactional programs to focusing on delivering business outcomes? And urge you, if you're on social media, just connect with me. Take out your phone, scan this QR code, and connect with me. I'm available. I make videos like every 2 or 3 days, to talk about some ideas of how they can increase the work performance. Connect with me on social media. Scan. This is a link tree, and of course, you open up to my social media page as well. So, ladies and gentlemen, I hope that you have come out with some ideas, and at the same time, focus. I really, I get really excited when we use solution focus to help clients deliver business results. And the best part is if they can quantify it, and put a number, a dollar value to it. Wow, all of a sudden your program is really, it makes sense for them to use it, and to buy it. And after a while, what we started off was also very small. We just, the senior leaders, when they heard me present, they were like, what you say sounds good, but we're not sure, right? We're really not sure whether can you deliver on it. And I just told them, okay, it's fine, you don't have to believe me. Why not we just go through one run? Just a trial run. We go through the whole process, D1 to D5. And after that, and after one cycle of 3 months, you can decide after that. And when they went through it, you saw the results that they wanted, and immediately they said, okay, can we have the same program for the next 300 people? And things change. And that's amazing, because right now they can see a program, and they're very clear of what are the business outcomes they can see. And of course, everybody has different things that they want to work on. But right now, the leaders can see for themselves what will be a visible change that will help their organization deliver better patient experiences. So thank you for listening to me. And I hope that this session has been worthwhile. This is important, I think, to persuade. So if you're a trainer, you need to persuade organizations to show them that this is viable And not only that, it delivers results. So consider a whole consulting approach. But if you are internal, you have to persuade your bosses, your leaders to undergo, to try this out. You have to help them see and speak the language that they understand as well. Focus on business results and help them focus on a process rather than just a training. Yeah. Thank you very much, everybody.
Kenneth, it seems like you have worked with many leaders and organizations. Have you ever applied your approach to open course programs, like a very general leadership or program around skill building? I'm curious about that.
Yeah, in fact, we just we do public runs as well.
Mhm.
But the public runs only focus on D3, delivering the immersive experience. We are not able to work, the D1, D2, 4, and 5 with the clients. So we are very clear with them. This program is just basically a public run where you work on something, but we can't ensure a very specific business result. Yeah. And what we found out is, interestingly, when you help clients focus on a process, you can actually charge it for more expensive. You can actually, yeah. And that's quite cool, right? Yeah, it can bring it up 30 to 40% because they realize they're not just buying training days now. They're very specifically focused on business outcomes. And that's the positioning as well. I think we need to help the client to realize.
I'm kind of curious, Kenneth, with this idea of like sharing the outcomes. It sounds like you do like a presentation, like an afternoon where people come in and, I don't know, an hour or 2 hours that they just present. How could you give me maybe a bit more idea what that looks like? Do they prepare slides, or how do you have this, be a
great question, Annie. Great question. So I'm a very structured person. I need to see the exact flow, and so we even set them up for success. We leave it little room for interpretation. We try to make sure there's consistency in the presentation. So there's a video that I share with them.
Okay.
Just about 1 month before the presentation. What are the markers to look out for? What will leaders be interested to hear? Like what's before, what's after. If you can quantify what's better, that's great. If it's observable behavior, just observe the difference. But it's something that you can quantify, that's great. Okay. So, and after that, on the actual day, the mini initiative where they do the short sharing of this, what we call it a coffee chat session, where the leader will be there. They will have coffee, they will just chit chat. Everybody has 4 minutes. They'll do a presentation and they follow the format, and maximum 4 slides. That's all, maximum 4 slides, because we think it's not about the slides. It's just you sharing the different differences, and for you to be able to quantify, that's what makes it more important. And of course, one of the slides is acknowledging the team members, who are the people that you have co-created with, and of course, they need to use the deep model to explain, the process and what's better after this process. Yeah. And of course, once they finish, they celebrate. The leaders are there to celebrate and to thank them personally. And you go one by one, they'll shake their hands, and say, wow, I didn't realize that this is happening, but right now I can see it.
Yeah.
And it's exciting as well, because the leader shares the joy. You see a senior leader sharing a joy with you of the work of your hands, and that's important.
And you'd have about 10 of these like 4-minute
20 people. 20 people. So
20,
it lasts
20 of them.
for
Okay.
maximum of, there should be about 90 minutes of presentation. But it takes about 2 hours in total. And a short reception as well. In Asia, everything revolves around food, so they need to have some food around after that, after the presentation. Yeah.
Super interesting. Thanks.
Yeah. Do the if I may ask a question, Ken, do the leaders ask you for more specific outcomes, or is it more we're happy with just anything improves? I'm just curious.
Yeah. They are happy with anything right now that will move the needle towards a better patient experience. So they're open, and they usually leave it to the reporting officers to have a discussion. So some of them can be very simple, like, I just want to create more appreciation, within the ward. And you'll be surprised, and that's important as well, because some of them don't feel recognized. And of course, there are some with more tangible outcomes. Like we want to reduce the waiting time. And in public hospitals, waiting time is really a very messy thing. And how do we, even if they're waiting, can we create beds, to help the people, move them out from the emergency ward so that they don't feel that they're just waiting there. There are beds waiting for them at the site, and they have created like 100 over beds. So the conversations with their reporting officer is really important. Yeah. In creating something that will create a win for the department and for themselves as well.
Thank you.
Welcome.
In these programs, my experience is often that there are like side effects or other impacts that are not expected, right? So we're expecting to work on results and saving time and costs and so on. And I've had the side effect before, like people complain less in the organization, or we're noticing that there's more conversations across departments, which we didn't have before. How do you bring this into the kind of results as well? Like how is that brought in? Or,
so one of the criteria that we look out for is give evidence, right? It has to be evidence-based as well. What do you notice exactly is different? So that's why the quantifying, the noticing is important. I mean, it's a hospital. They don't take flakiness.
and you think, for example, the tiredness, right? Everybody's exhausted, and how do you measure that people are feeling more engaged or fitter or something?
Yeah. So of course, not everything can be demonstrated in numbers as well, but they can notice what's the visible differences. When they start talking and engaging, they notice that it takes. So if it's a behavior, they just need to describe the difference in the behavior, and that's useful as well, because they realize that, and they are also very they know that you can't measure the behavior right now. Yeah, but you're right in saying that there are side effects, because we start sending a survey out to the rest of the staff members to find out how did this particular person engage you in the discussion. Can you rate this leader? In how was your experience with this leader? Did the leader create a safe environment for you to speak? The leader consistently solicit for your opinions? Yeah, and this is important because these are all the engagement questions that in the engagement survey, these are the exact things that will happen. So when the hospital sees these questions, they were like, yeah, it makes sense. I want all my leaders to be able to engage their team members or even their colleagues, in creating these conversations. Yeah. And this one we can measure.
About the measuring, do you ever do like a baseline and before and after? Because you probably got some expertise. What are the pain points, right? So like a 10-point scale, how tired are you?
So you can start with a baseline, but I think what you could just do, you can just do like over a 3-month period. The leaders are going through this program. Can you rate do you feel that it's a +1? Has the leader, was there minor improvement? Is there a certain level of moderate improvement, or a lot of improvement? It can be a +1 to +3 scale. It could be a -1 to a -3 scale as well. Yeah, this is something that you can have, because they may not have a baseline, but they can see visible differences.
Also, in the last 3 months, it's not such a huge time span, so it's kind of easier to assess.
Yeah. And we're only looking for very specific behaviors as well. We're not measuring like everything, because engagement is a very big word, right? Yeah,
exactly.
So you can simplify, make it easy for you to administer. That will be useful.
Mm.
And the best part is, because the people are rating the leaders, the leaders have every vested interest to do a good job, because they're not the ones who say that they have improved. It's the people are rating the leaders. So there's a certain level of pressure as well for them to make sure that they're going to do it well and really engage, do everything that they have learned.
Mm-hmm. Well, wonderful. If there are no further questions, then what we'll do is slowly close the session in this chapter meeting. And for SFIO, it's very important to have this diversity of experience and share what is possible in organizational development with SF as well. And thank you so much, Kenneth, for coming and sharing this case with us, and looking forward to the next case. And everyone, if you would like to just leave a little word for Kenneth in the chat, what was really useful for you in this case study? In that way, it's an appreciation, and at the same time, you have a good idea of what messages you should be repeating that are very useful for practitioners. So Before you exit, a little word in the chat would be very, very nice and appreciated. And you can just sit back and enjoy Kenneth and read the messages as they come in.